You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
This is the RxGenius podcast, where we discuss better healthcare with the professionals who are making healthcare better. Hosted by pharmacist and epidemiologist Ryan Paul Liabenow, the show dives into the science, strategy, and real-world stories shaping modern medicine.
I am your host, Ryan Paul, and I am so excited for this episode. We have got an amazing guest on the line today, Wilson Tam from Inovalon. Wilson, thank you so much for being with us.
Thank you so much. Man, the energy coming right on, Ryan. I love it.
I'm trying to.
And I was like, woo!
Yeah, there you go. I did. It's actually been a difficult day. So I was trying to reset, bring back some energy that maybe doesn't really exist, and have to be able to have this conversation with you, because I think it's important. So the audience knows we are going to talk about empowering healthcare with data-driven strategies, right? And that says a lot. We're going to go down a couple different roads. Data is so important to healthcare. We're going to talk about ethics. We're going to talk about the patient experience. We're going to talk about what data does, what it tells us, what it doesn't tell us, what we should do, what we shouldn't do, all of these things. And what a better, there's no better organization to have this conversation with than Inovalon, because Inovalon's doing so much incredible work with data. And so, Wilson, thank you so much. Wilson Tam, PharmD, right? That's PharmD. He is a pharmacologist. We are going to make sure, give him credit for all of that student debt. He is an incredible pharmacist, and we have an incredible network of pharmacists that are listening to this podcast. And so it's always great to get PharmDs on RxGenius, because we don't always get a chance to. There's so many pharmacists on that host the other podcasts. Very rarely do I actually bring pharmacists on, because we try to have a different conversation. So it's so cool that you are in the middle of what's happening in healthcare data and data science and data analytics. And so tell us a little bit about your background, how you arrived here with Inovalon, what you're currently doing, and then I'm going to jump in with some questions that I have for you.
Yeah, absolutely. So thank you so much for a really good introduction, both for myself and the topic we're going to be talking about. So I am a pharmacist by background. I got my PharmD at St. John's University. I actually worked in a call center doing medication therapy management as I started my career. So calling patients, talking to them about their medications, doing comprehensive medication reviews, really kind of trying to save the world by talking to people about their meds. Eventually, I moved into the specialty pharmacy space, where I worked with HIV patients in New York. So I was in charge of our clinical team. And so really what I was most concerned about was that patient experience and that patient journey, especially clinically. I think HIV has come a long way since then. I mean, the therapies are much more durable than they have been in the past. So, but how I landed at Inovalon is the same software that I was using at the specialty pharmacy I was working for. That is the same specialty pharmacy software that Inovalon houses and sells and then makes available to specialty pharmacies. So I was kind of like the nerdy guy who loved playing with the software and configuring it and doing all of that as like a customer. And now I work on the vendor side. So I lead our sales engineering team. I spend almost all of my day doing demonstrations, coordinating the demonstrations, preparing for them, talking about the features, and probably most importantly, talking about how software and technology and data and how all of this is changing how pharmacy is being practiced, and also kind of where pharmacy is sitting in the healthcare landscape. So super excited to bring that experience and then talk about that and talk about kind of where we are at Inovalon, where the industry's at, and kind of some of the trends I've been seeing.
Yeah, and maybe that's a good place to start, as opposed to jumping into my questions, is where are we at? There's so much going on. What would you say is the most important, umbrella aspect to what's happening in data right now? What's that? Maybe what's that buzz? What's the buzz that's happening right now that's improving our situation?
Yeah, I would say, I don't know if it's necessarily buzz. I would say it's more of a coming to terms of the reality. So I think the reality is, when you think about social media, Facebook, our phones, right? Like, I can't go anywhere without Google Maps. There is so much data that exists on us already outside of healthcare. I think the reality that people need to come to terms with is that data in healthcare also exists on you, kind of wherever you are sitting. So when you go to visit a doctor, chances are they are putting your information into some sort of electronic health record. When you go fill a prescription, there is an adjudication that's taking forth back and forth, where like your information exists out there somewhere, someplace, and there's a lot of different places they're going. And people are worried about it. People are thinking about it. My perspective is it's actually really great that it's out there, because in the right use cases, it can really help patients. But I think we need to come to the fact that like the data's out there. The question is, how do we make sure we get the data to the right people at the right time to actually like make a positive impact? And then there's also the risk of, the data's out there. Like, what does that entail?
Right. Yeah. So I guess the next question is, when I think about how we get the data to the right people at the right time, for the right reasons, I think clearinghouse, right? I mean, like there's so many different clearinghouses in healthcare. It's just, I remember the first time I ever had a conversation about data, it was clearinghouse. I grew up in Michigan, right? So Michigan had a very specific data clearinghouse for Medical Information Bureau, right? So it was kind of like when I, with any type of background check or any type of life insurance policy or anything that had to do with the care that I had received was flowing through some type of clearinghouse. What does that look like today? Because it's far more sophisticated than it was, a decade ago.
Yes and no. I would say no. So Inovalon itself works with 24 of the top 25 payers and insurance companies. So as part of that, there's access to what are essentially like claims data that's pretty unique across that entire subsection. So the idea and concept is, data is only as valuable as like both how wide you have it and how deep you have it. So it's the intersection of, okay, we work with these payers, so we're able to aggregate and collate that data. We also work with, 20, 30,000 something other providers. So we also have a lot of that provider data too. I work with pharmacy business unit, so we have a good amount of adjudications and transactions and information on, medications as well. So when you take it across the different areas of healthcare and you start bringing it together and deduplicating it and putting, kind of an intelligence layer on it, that's when it becomes a little bit more valuable and actionable. On top of that, and this is why I say not really, there are like data aggregators out there. Commonwealth and Care Quality is like a very common one that people connect to. And then also there are a lot of these regional health information exchanges in like different states have different, and then different health systems are connected to different, HIEs and states. So essentially like what we are doing and what, some companies are doing is they're just tapping into all these like different silos. And then once you tap into all those different silos, you can bring it together and all of a sudden you have enough that stuff starts to make sense, if that makes sense.
Yeah, no, it makes sense. So like for the edification of our audience, we've gone to all of these resources, these clearinghouses, these health insurance companies, these data resource centers, wherever the data is, and we're collecting it. What would you say are the top 2 or 3 things that this data is used for, right? Maybe I know what it is, but like for the edification of our audience, what is like the most important things that this data is used for?
Yeah, I would say there's probably like 2 main areas. I would say, and there are a lot of use cases for it, but I separate it out into 2 main concepts. One is de-identified data that's kind of across an aggregate. So a great example of a project that we did was we were looking to see how we can improve vaccination rates in underrepresented communities or communities that don't have access to typical healthcare services. So we did cross-section of data, evaluated patient populations, looked at current usage rates, and like tying together a lot of different things. We were able to figure out like, hey, if we want to improve that, like this is the zip code or area that we want to do some of that work in. And that's like information that we can then partner with pharmaceutical manufacturers or healthcare providers to like do more intelligent programs to help that patient population. And all of that is de-identified because we don't know that Wilson Tam didn't get his flu vaccine, but we do know that that area that Wilson lives in is under resourced and like the overall usage is lower. So why don't we target that area? So I think there's going to be more and more kind of access and resources to allow for those kind of projects, but that's all de-identified.
Yeah, I think that I first came in contact. This is before I was doing my graduate work. I had come in contact with data sets for a school project, and it's just again for our audience to kind of understand. The data set was basically telling us what demographic in a particular geographic region type 2 diabetes existed, and taking that information so that we could then report back to a multitude of organizations, public health agencies primarily, so that we could then come up with a strategy to reduce the exposure of type 2 diabetes in this particular demographic, in this particular geographic region. And so that type of information, for as simple as it sounds, is so important because we're looking at that type of data on a regular basis. Even at like Mango Health, I mean, we have our own medication therapy management platform specifically so that we can collect data, so that we have the ability to be able to work with patients after discharge, right, for the long term, right? It keeps those patients in the wheelhouse of our specialty pharmacy, but it also gives us the ability to be able to work with them if they're, in our case, it's behavioral health. So if there's a relapse, if there's a hospitalization, if there's something like that, we have the ability to be able to know that because we're plugged into the system. And if we didn't have that type of data access, then we wouldn't know, and therefore we would have poor data, and that could, quite frankly, impact the way in which we run our clinical programs. So it matters. And so with that said, it matters so much, especially in vulnerable and marginalized populations. So I want to talk a little bit about that because I think it's still really important for us to have the conversation about health equity, right, and social determinants of health, and how we take that data to be able to serve under-resourced communities, to be able to serve vulnerable and marginalized populations, and ultimately be able to get to an end that we would not be able to get to without data. So talk to me a little bit about what your experience is in looking at regional opportunities to be able to improve populations with data in general. By populations, I mean vulnerable and marginalized or under-resourced, as you said. I love that. I think that's a great way to put it. Under-resourced communities, what data is doing to be able to help providers, right, and public health agencies be able to do better work.
Yeah, it's a great question. I think the data has gotten really good, and this is maybe me being a little bit of a pessimist here, but the challenge remains like and this is like my pharmacist brain, like, okay, we know that this area is not great. What intervention are we going to do to move the needle? How much money is it going to cost to move the needle? And then if we do put that money towards it, how much of that needle is it going to move? Like a lot of like, I would call it like proof of concept type projects out there. I don't think that there's like a great summation or like a kind of like solution that exists for that. I think it's going to be a lot more holistic, like community-based outreach things. And these are like all things that we always knew, right? Was there the right parameters in place for us to enact a lot of those interventions, and do they work, and how much they work, and is it worth it, and what's the ROI on health, which I think is always crazy to think about. But to answer your question, I don't think there's like a one size fits all. What I will say, and it is a good transition into kind of the next section, is that's all de-identified data. Inovalon also has an identified data solution, and we call it data stream. And we actively use it within kind of the pharmacy industry, which is really kind of my specialty. And the reality is, a great example I bring up is every time you go to a new doctor's office, they give you a big form that you fill out, right? And then you're filling out the form, and at some point you start to think about it, and then maybe they refer you to a specialist, and you fill out a form again. Like, at some point you start to think about, okay, like, I'm filling out the same information over and over and over again. And for most people, it'd be like, all right, what if there was like a common resource where you just share it, or you don't have to do it again? Like, when you go see a doctor, and some patients have multiple doctors. They have their primary, general, and then they have their specialists, and they have different, even non-prescribing healthcare practitioners that they see. What if all of that information was available? Like, that's a very commonplace thing we've been talking about for 10 years. The difference is with DataStream, we now make it available for the pharmacy for treatment use cases. And so when I talk about treatment use cases, that means I, Wilson Tam, as a pharmacist, am actively trying to fill your medication. I want to figure out how I can get the medication over to you, Ryan. And because of that, I'm going to tap into all of the information available. And so now I can see your ICD-10 codes, which is, okay, what diseases do you have? I can see the medications that you've taken before. So that way, if I do need to fill out a prior authorization form for you, instead of me having to call you and then call your doctor and then track down different charts and try to like navigate all that, a lot of that information is now available to me, and I can get a lot of that going for you so that you can get on therapy.
Okay, and so does that actually sit on a dashboard on a access? So that's actual Inovalon software or cloud based? What? Talk to me about that.
So ScriptMed, which is our pharmacy platform, we target specialty pharmacies and home infusion pharmacies as one of the tabs or dashboards. Like, when we click into a patient profile, if data stream is enabled and turned on and we make that call, all of that information sitting on different tabs that we can look at. We can look at information tied to ICD-10 codes, other medications, allergies. There's also some lab and biometric data that's available as part of our data stream product. So all that is available. And a lot of it is the real question is now, okay, now that we're getting access to that data, how do we tie that data into a more automated workflow so that we're not having a human like look at data and then try to make this. We're having a human look at it, and then that information is starting to populate in other areas where we can either do interventions or help fill out forms or things like that. And that's kind of like that next evolution of the data is great, but like if it
actionable data is better, right? Yeah, absolutely. I'm gonna leave this topic alone, but I want to address it. I just want to get your thoughts on it. Is really kind of going back to data in under-resourced communities. And again, people know, so like people understand, like when Ryan asks these questions, they get it because they know the type of population I work with. So it's not lost on the audience. They're like, why, Ryan, why do you always go there? Well, I always go there because it's super easy to solve healthcare problems for rich people.
Yeah. You can throw money at the problem.
Yeah, you can just say, hey, we're taking care of it. And great, God bless. But how can we ensure that data-driven healthcare systems actually are empowering these patients rather than deepening existing disparities in access, quality, and outcomes? So what is the data doing that's truly empowering? And I know that it is, right? So that the premise is I know that the data is empowering. Question is how is the data empowering these communities to take care of this patient population. Because for as much as, and we'll talk about this in a little bit, for as much as data is valuable and provides insight that is priceless, data can also be harmful, right? Because it can give us a view into populations, and we can actually harm with data. Information can be used in a lot of different ways. So what would you say is like the number one way in which we take that data out and elevate, right, our ability to be able to, from a public health perspective, improve social determinants of health, make sure that that there's equity and not disparity in these populations?
My perspective on this is you need to give the folks on the ground better tools, better data, better information, better tools. So it reminds me of I worked a lot with HIV patients in New York City. Historically, challenging population, I would say. Very transient. Like, we used to call them to schedule their refill, but we need to know when to call because we knew at the end of the month their minutes were going to run out on their phone, and like there's just so many social challenges that we don't know. So the ability to have access to better data, just the ability of even claims data related to emergency services. If I knew that Ryan landed in urgent care or the ER like last week, like that's now something that's information I didn't know before. I would have never known, and now I know that. Oh, okay, that means I need to track down Ryan to figure out A, what happened to land him there, and then B, what kind of interventions and additional services we need to make sure that Ryan has so that he can be happy and healthy again. Like just even those tools in the hands of the right people who are like boots on the ground, local, have the relationships. That's the only realistic way that I think we're going to move the needle here.
I agree wholeheartedly. That is the answer right there.
Yeah.
So thank you for sharing that opinion, sharing that worldview. I mean, it's so nuanced, right? Because healthcare in and of itself is not me going to my primary care physician and picking up a script all the time. It's all of the things that happen in between that arise these episodes in life that make me arrive at a particular event where now I do need my PCP, or I do need this, or I do need that. And so I think it's important for us to have all of the tools to be able to collect data that kind of is peripheral. I mean, that's, what you're talking about is talking about tools, just being able to gather data around things that are not necessarily directly about what we assume healthcare is in the general population. And so it's so important to be able to take those considerations.
Yeah. And
with that said,
let's say you were working with me, right? If you've been talking to me for 3 years about your medications, you don't want to talk to some other person with I see that you were like, no, I'm only going to talk to Wilson. So it has to be that kind of, I think the relationship is key. And then we can get those stakeholders to have better tools. That's the only way it's going to happen.
Yeah, I agree. I think a huge consideration in data is the ethical consideration, right? That's just number one. It's, this is a sacred, if we treat this as a sacred responsibility, right? De-identified or not, right? There is a human aspect in every data point, right? That we have to have a level of respect about. And the way that we talk, the way in which we move, the way in which we share that information, the way in which we, even the way in which we monetarily benefit from that information. So in your opinion, what ethical framework should guide the collection, sharing, and use of patient data to balance innovation with privacy and informed consent? Right? So I know that's a lot. So let's start off with what, in your opinion, is the most important ethical consideration when talking about data and the movement of data and the sharing of data?
Yeah, I take a very liberal view on data and what is appropriate to utilize and share. And so this is my perspective on this, not Inovalon's. There's the legal perspective and then, my personal opinion, right? The legal perspective is as long as it is for quote unquote treatment use cases, it is an appropriate use of patient identified data. So if I am your physician and I'm going to treat you, I should be able to pull all of your patient-specific data. If I'm a pharmacist and I'm trying to actively get you medication and then fill those medications for you, that is an appropriate use of data. I take an even more broad spectrum thought on it. I think like any kind of like clinician or practitioner who is like doing those things, I'd be pretty comfortable having them share data. So if it's like a nurse and they, need to treat me, or if I land in the ER, I would prefer for whoever's triaging me or looking at me in the ER to have all of that information available at the fingertips. I think at the like practitioner level, I have no idea. I have no problems with any practitioner having my information. The challenge becomes when it becomes more of an administrative thing, or there's a program, or there's like evaluations. And I think this is very relevant given some of the news with the big healthcare payers. I think everyone's biggest fear is that, well, if they have access to all this data and they can use that data to deny me access to either a medication or service or something that I need, that's when it gets very scary. That's when it gets alarming. And you kind of, I think you mentioned it earlier, but you kind of start seeing this in like other commercial areas too, where people will be denied, insurance or other things, even non-healthcare related, but like denied based on other factors. Like if you're bringing someone's health into potentially doing some sort of administrative activity, I think that's when the magnifying glass really should be on those kind of activities. Given where we are today, that all the laws don't allow for that kind of activity. You really need to be using it for a treatment use case to have access to that very specific patient-specific information. So kind of where we are, and that's kind of how I feel. And then I feel
I don't disagree. I mean, I think that there needs to be a hard line in the sand as it relates to what is acceptable and what is not acceptable. And I talk to you, I speak as a former PBM executive, right? About just the way in which we disseminated data that was coming through our claim systems, the adjudication process, the data selling, the rebate game, the aggregation of data in and of itself, the way in which contractual games are played to own that data. There was a time where it just felt, I got out of the PBM world because I felt that it was exploitative, right? And it's pretty well accepted, right, on this channel that people are not huge fans of pharmacy benefit managers, right? So when I talk about my experience, people are like, well, that makes perfect sense, right? But there was a level of discomfort, and I was a baby, right? I mean, I was 20. This is before I went back to school and thought I was just going to, I was going to be in the health insurance kind of PBM. That's the world I was going to be in. And the things that I saw and the way in which we treated data, right, was for only one reason, and that was to aggregate data to make money, right? That was just the bottom line, right? Everything else was secondary to that. And the reality is that the interaction with the patient, anything that we were doing to service the patient, whether it was working with them through step therapy or prior authorizations or whatever it might be, all those actions were secondary to the fact that that patient had a dollar symbol on their forehead. And that's the way I always felt about it. Obviously, I became jaded, disenchanted, and I never went back, after I went back to school. But I think that a lot of people feel that way is that, from a health information perspective, there's part of this audience that's saying, Ryan, Wilson, like, that's my information, right? Like, why does everybody get access to it, right? And so I think you make a great point that, like, look, your clinicians need that information because it's going to save your life one day, right? And if you are in Nevada one day and Washington, D.C. the next, or New York, and we've got good data systems in place to where we didn't give you a medication while you were in a coma that you were allergic to, right? Because we had the right data, we had the right information to save your life, then you're going to be super thankful that people were sharing your medical information, right? But then there's that fine line where I think, at what point am I a number on a wall, and I'm just a data point? I'm just research for the cog, right? I'm just a part of the machine. And I think that people feel that way. And so I think it's important for us to, and I know you'll agree with this, it's just important for us to have this conversation to say, no, we're not doing that with your information. We have deep respect for the data that we're receiving, and we're doing the honorable, ethical things with it because we want to save your life. We want you to have quality of life. And the majority of us that are in healthcare, we're not that 2 or 3%, right? That are, we're not Wall Street, right? We're here to service the patient, right? So I think a lot of times people lose that perspective.
Yeah, and Inovalon's very conservative on what like a treatment use case is and what it all entails. I think so. My perspective on this is I think large companies are not going to take the risk to misuse that data in the kind of ways that you're talking about, just because it would open up a can of worms and open up liability that would be incredibly financially painful for them. I think the fear, or at least my fear, is like, okay, do we have a level of security to ensure that like leaks and other things, aren't able to get out? And the challenge is, Inovalon's very secure and very diligent about the way we handle data, but we too are drawing from other sources. There are other companies that are drawing from other sources. If there was a leak, and once it's out there, kind of out there, and it's happened more so across every other industry outside of healthcare already. I feel like we hear about a new leak every week, and so the question is, once it's out there, then does that open Pandora's box, and what's the concern and worry there?
Yeah, I mean, my Apple password was jacked like 2 weeks ago. And it was. I'm like, what in the heck is this $50.27 charge on my Apple Pay?
Yeah.
And yeah, I mean, that's just the nature of the beast, and that's going to happen, and you have to be diligent, and you have to check your accounts, and that's just, we trade a level of privacy for convenience, right? And that's just that's just reality.
I carry the phone everywhere with me. There's literally a blueprint of exactly where I go, when I go, what I buy, what I look at, and we know that data is being fed back to us to try to sell us more stuff. Mm-hmm. That same data exists for your healthcare as well. The only difference is, we have the noble thought of like, okay, we're at the clinician level, at your pharmacist, doctor, and nurse, and everyone kind of at that level. We're really only using it for the betterment of patients,
Yeah, so that is the majority, if not the ultra majority of the time. And I think that it's just important for people to hear that, right? Because again, people have this, people talk, right? And they watch the news, right? And so they become uncomfortable with participating, right? And that fear gets in the way of meaningful interactions in the healthcare space between provider and patient, clinician and, cases. So it's really important to be, I guess, diligent about it in, again, declaring what it looks like and how important ethics and privacy and protection is in this process. So it's awesome that Inovalon has made that such a huge priority, and I imagine not only just made that a priority for Inovalon from a corporate perspective, but it's preaching that gospel to all of its partners as well, so that there is cohesiveness in all of it. But you're right. Big companies, they're not gonna put themselves in that position. It's not worth it. The catastrophic slap that an organization would get far exceeds any minutia of a benefit that would exist in that. So I think that that's important. I think another thing that I was thinking about that I wanted for us to talk a little bit about is artificial intelligence, right? Mm-hmm. I mean, I think I'd be remiss in at least not bringing it up. I do another podcast called MindBridge. It's a behavioral health podcast, and we actually did artificial intelligence in mental health and addiction treatment and digital therapeutics, and it was super interesting. Artificial intelligence is just a part of our life now. I think for most of us, we've accepted it. We're moving on it. I am so interested in it. I actually launched an AI lab to build pharmacy tools powered by AI, right? Clinical decision-making tools. Talk to me a little bit about like what Inovalon's view is on artificial intelligence, how you're utilizing it. Maybe you're building something right now. You're enhancing some things that currently exist.
We are building stuff. I think some of those press releases haven't gone out yet, so I can't talk about
fair enough.
With that said, I was just at the previous pharmacy conference, and there are a lot of AI vendors out there. My perspective is when we think about AI, or like the original promise of AI is how do we enhance the clinical decision making or clinical decision support, or how do we help patients along the way? I actually take the opposite view on it. So I think the low hanging fruit for AI is how is it going to do some of the tackling and blocking and like repetitive tasks that are administratively burdensome to healthcare providers, and how is AI going to help that? So when you talk to doctors, the biggest complaint that they have is burnout, specifically burnout to administrative things that they have to do. So
right.
If we look at AI, at least in the pharmacy space, from my perspective, I think OCR technology wrapped into a language model is going to be incredibly impactful. So today, we still get prescriptions, referral forms, and labs in the form of a fax. If I can take that fax, and instead of having someone type that stuff in, take that fax and automatically populate it in with a confidence interval based on this, I'm like, oh, if it says, BP with MMHG in that way, it's pretty confident that's blood pressure, right? So taking that and then turning it into structured data, I think that's one. And then the second thing is some of the agentic AI that is starting to take place, where I've seen you actually have agents who sound like people. Pretty good. I would say 95% there sound like people making phone calls outbound. And so there's like two use cases for that. So you can use that to schedule deliveries or schedule nursing services for patients. Another thing is you can actually use that agentic AI to call insurance companies to find out about their benefits, so that you can figure out how to get this drug covered for that patient. And so it's getting there. It's getting to the point where it's almost like a dead internet theory, where we're having bots calling bots, and that's the best solution that we can come up with to figure out our healthcare administration. But that's where I see like repetitive task automation and some of the agentic AIs where, if it's the same thing that we're asking a person to click, we can use AI and bots to start doing a lot of that activity.
Yeah, it's exciting. I know when we had the conversation about AI on MindBridge, we were talking about what stood out was super interesting. It was the question of whether it's professional or personal, whether it's clinical or not, is AI somehow disconnecting us even more than we already seemingly are sometimes? And John Nosta, our friend John Nosta, said, I actually think the opposite is true, that although we will give up some of our IQ, we will actually increase our EQ, our emotional quotient. And artificial intelligence will actually give us the ability to be more connected to one another because we won't be doing some of the things that disconnect us anymore. So a really interesting kind of take on it, because I think that when we talk about clinical decision making and machine learning, how do we make sure that we're not marginalizing the human experience in all of that, or that's what the concern is. And so really important, again, I think it comes back to ethics and important ethical conversations around artificial intelligence and the importance of it. And, I am going to be, what did I say today? A lot of folks know I'm the founder of a healthcare focused hedge fund called Loxley Capital. And I literally told my banker today, I am the oldest 43-year-old you will ever meet. Right. So my worldview is like, I want to sit down with a banker. Right. I want to sit down and talk to my physician, and I want my pharmacist to like look me in the face when he's handing me my script, those types of things. So like, I'm not always like the greatest like audience for, even though I'm like invested in technology, I'm not always the greatest audience for it because I'm still like stuck in this very, hipster view of the world when it comes to these types of things. So, I struggle with it sometimes, Wilson, I do.
I think I would say it's pretty, that kind of stuff is pretty far away. I think because like, AI and some of these models, like, oh, they can make more accurate diagnoses than physicians, or, oh, it can read x-rays better. At the end of the day, there's still a person there who's like, okay, yeah, that's correct. Like, you actually got it correct. And,
Yeah.
I don't think that's where the next 5 to 10 years is going. The next 5 to 10 years is, hey, I've spent 8 hours filling out these prior authorization forms. Can I get a machine to
Totally agree.
take that data that I extracted and type this in for me? And like, if I'm talking to a physician today, like, there's like what, scribes that follow around and then take notes.
Yeah, it still exists. I remember I used to my house growing up was next to a like a script. They literally all day long, that's all they did was write scripts.
Yeah,
and I'm thinking
AI is gonna like do that. It's gonna do some of the lower level functioning, blocking and tackling, like just administrative burden that we have in healthcare today. I don't think it's gonna replace the high level critical thinking. It's just too hard,
Agreed. I think that it's exciting times for artificial intelligence. I think that we only stand to benefit from this. I'm not fearful of it. I think that any fear that might exist can be overcome across the economy, right? I mean, not just healthcare, although we are talking about healthcare. It's a little easier for us in healthcare, I think, from tech. There are certain industries, and we're working in one of these industries where, like banking, finance, healthcare, engineering, where artificial intelligence just is a no-brainer. And I think that there are other segments in industries where workers are genuinely concerned, right, about it. And so I think that it's also, I think, important not to take that for granted, because we're going to benefit from it without a shadow of a doubt. So I mean, this is a great conversation. I mean, that we could go on forever, because I've got tons of questions. But like, I think what we should do is we should plan on having a part 2 and doing a follow up. And I think that Inovalon is going to be doing some. It sounds like you guys are building some tools, some additional tools, some additional resources. There's so much that we can talk about, and I think that we should do that. We should have a round 2. But I want to give you an opportunity to wrap this up, and what I would ask of you is that, like, when it comes to data, right? We understand that every stat we touch represents a life, right? It's not just a number, but it's a story about pain, it's survival, it's loss, it's life, it's death. And maybe, I'm grandiose or dramatic about data, but I really, when I look at it, I I always tell people, look, you can give me, and I know I can give you the same claims adjudication sheet. You give me 90 days worth of med orders for a population of 10,000 people in a city of 100,000, and I will tell you what their problems are, right? So I love data. I'm the first guy to love data, but genuinely love people more. And so share with me kind of your worldview as it relates to why it's so important for you to continue to do this work, and why it should be important to others.
Yeah, if there is one summation or takeaway, is that your data is already out there. It's the same way that Google, Facebook, all the your data's out there. Every time you see a doctor, your data's out there. Every time you put your phone in your pocket and you go somewhere, your data's out there. The noble thing about healthcare, at least at the clinician level, is we're now working on getting those frontline folks better tools to help patients. If we go back even 10, 15 years ago, like we used to do this all by paper. I used to manage refills in a binder, like Ryan's going to get his meds on the second Tuesday of every month, or, like that's how we used to do things. It's already come very far, very quickly. If you somehow land in the ER, imagine they just had everything about you available immediately to that provider. It's only going to help improve them, make better decisions on how to. And ER is the best place because you need to make a decision. You need to make a decision fast, and you kind of live with the results of what you get. So having that data available, I think, is invaluable.
I love it. Thank you so much for sharing your time with us today. And to the RxGenius podcast listeners, we love you. We believe in you. We hope for you. And stay healthy.
Thank you so much, Ryan.